Welcome to Health Source of Houston Memorial, Texas. Today's topic, treating cluster headaches with oxygen. Few things are as intensely painful as cluster headaches. Cluster headaches are defined by their sudden onset, intense pain, and frequent recurrence over a short period of time. The burst of headache activity is usually followed by a period of calm before the next attack ensues. Suicide headaches. Cluster headaches are so painful that they are recognized as one of the most painful conditions in the world. Women have reported that they are more intense than labor. Accompanied by sharp pain around and in the eye, the top of the head, or down the neck, people have described the pain as similar to having a spike or red-hot poker jabbed into their bodies. Believed to be caused by an abnormality in the hypothalamus, cluster headaches usually strike at about the same time each day. Brain imaging techniques show that specific areas in the brain are only activated during a cluster headache attack. And while the attack itself is benign, in that it doesn't actually do any physical harm to the individual, when a severe incident occurs, it should be treated as a medical emergency. Oxygen treatment isn't new. The best way to treat the onset of a cluster headache is to cut it off at the pass. Abortive treatments vary, but the use of pure oxygen has been demonstrated to end the attack within 1 to 10 minutes. If the headache reaches its peak, no amount of oxygen will help, and other options are more effective. The use of oxygen to treat cluster headaches was first noted in 1939 at the Mayo Clinic. It was noted that people with severe migraines often recovered quickly when given 100% oxygen to breathe. Studies showed that up to 80% of patients with cluster headaches received significant results from oxygen therapy, slightly higher than the rate of success with ergotamine medications. The effects were also felt more quickly. Side effects are few. There are a few side effects associated with oxygen therapy. The primary concern is that a majority of those who suffer from cluster headaches are smokers. Oxygen and cigarettes are an explosive mix. The risk of a patient lighting up while attached to oxygen is small, but it should be considered. Another noted side effect is that of a rebound headache. About 25% of patients experience some degree of headache rebound after treatment. Still, when compared with the side effects normally attributed to ergotamine, this is relatively benign. Migraines can also be treated with oxygen. While the research isn't as conclusive regarding the treatment of migraine headaches with oxygen, it is known to be helpful as well. About 50% of all sufferers will experience relief through the use of oxygen. If, however, there is no improvement after 30 minutes, none can be expected. For those who suffer from cluster headaches, the use of oxygen can be a real boon. The concept of eliminating the headache within a matter of minutes for someone suffering from excruciating pain can only be imagined. With few side effects and a long record of successful treatment, oxygen therapy should be made more available to those with cluster headaches. To find out more information on topics like this, please go to healthsourceofhoustonmemorial.com.